Welcome to Long Live Seniors, your channel for health, strength, and wisdom in later life. Today's topic: high blood pressure in older adults, why it often begins in later years, and exactly how science shows you can manage and lower it. Stay till the end, because you'll learn 3 daily habits backed by research that can reduce your risk of stroke, heart attack, or cognitive decline, and help you keep your independence. Let's begin. First, let's be clear on what hypertension, high blood pressure, means. Your heart pumps blood into arteries. Each heartbeat pushes with force, measured as systolic pressure, the higher number. Between beats, when the heart rests, the pressure is diastolic, the lower number. A typical normal might be 120 and 80 mmHg. When those numbers stay elevated over time, even if you feel fine, we call that hypertension. The danger: over years, this extra pressure damages the delicate vessels in your heart, brain, kidneys, and eyes. That's why hypertension is often called a silent killer. In older adults, we especially see isolated systolic hypertension. The systolic number goes up, say, 140 or higher, while diastolic may stay the same or even drop. This is largely because as arteries stiffen with age, they don't absorb the pressure pulses as well. This phenomenon is well documented in aging vascular research. Frontiers +3 PMC +3 Biomed, Central +3, also. Hypertension in seniors is strongly linked with higher risks of stroke, heart failure, chronic kidney disease, and dementia. In fact, studies show that arterial stiffness, a hallmark of vascular aging, is an independent predictor of cardiovascular events and cognitive decline. AHA journals +2 AHA journals +2. Because of this, controlling blood pressure in later life is not just about numbers, it's about protecting your brain, heart, and quality of life. Why does hypertension increase in seniors? In this section, we'll combine physiology plus research so viewers understand that hypertension in seniors is not just bad luck, but tied to aging changes that are partly modifiable. Arterial stiffness and vascular aging. As people age, the large elastic arteries, especially the aorta, gradually lose elasticity. The walls of arteries contain elastic fibers, elastin, and collagen fibers. Over time, elastin degrades, collagen accumulates, and the vessel wall becomes stiffer. This increases pulse wave velocity, PWV, the speed at which pressure waves travel down the arteries, and is a clinical marker of arterial stiffness. Nature +E4 Frontiers +E4 AHA journals +E4. When arteries become stiff, they can't buffer the pulsatile force of each heartbeat. That drives up systolic pressure and widens pulse pressure, the difference between systolic and diastolic. Biomed Central +2 AHA. Journals +2. Interestingly, research suggests that arterial stiffening can precede and help cause hypertension, not just result from it. In animal models, stiff arteries have been recorded before blood pressure rises, indicating that stiffness may contribute to the onset of hypertension. PMC +2 in humans, longitudinal studies, like the Framingham cohort, show that higher aortic stiffness predicts later development of hypertension. AHA journals +2 PMC +2. Thus, hypertension in seniors is both a result and driver of vascular aging, a vicious feedback loop. Other age-related changes and risk factors. Arterial stiffness is the core, but many other changes with aging contribute. Endothelial dysfunction, inflammation, and oxidative stress. The inner lining of vessels, endothelium, becomes less able to produce relaxing substances like nitric oxide. Chronic inflammation and oxidative stress interfere further. Biomed Central +2 Biomed Central +2. Impaired regulatory systems. The renin-angiotensin-aldosterone system, RAAS, and baroreceptors, pressure sensors in vessels, lose sensitivity, so blood pressure regulation becomes less responsive. Biomed Central +2 PMC +2 Metabolic factors and comorbidities. Many seniors develop metabolic syndrome, insulin resistance, obesity, or diabetes, which accelerate vascular damage and stiffening. PMC +2 MDPI +2. In fact, reversal of metabolic syndrome via weight loss has been shown to partially reverse arterial stiffness in some studies. PMC +1 Sleep disorders, especially obstructive sleep apnea, OSA. OSA causes intermittent oxygen dips, sympathetic surges, and vascular stress. Many older adults have undiagnosed sleep apnea, which is a known contributor to hypertension. AHA journals +2 PMC +2 medication effects and excess sodium. Some over-the-counter drugs, NSAIDs, decongestants, can raise blood pressure. Also, sodium retention increases with age, making the same salt intake more harmful. PMC +1. All these factors combine in older adults, making hypertension common and more challenging to treat. What does research say about ideal blood pressure in seniors? Once we accept that hypertension in seniors is complex, the next question is, how low should we aim? How aggressive should treatment be, given risks in older people? Falls, low perfusion. Major trials and meta-analyses offer guidance. The STEP trial in China targeted systolic blood pressure 110 to 130 mm Hg in older hypertensives and found significant reductions in stroke and cardiovascular events compared to standard targets. New England Journal of Medicine meta-analyses combining SPRINT, STEP, and ACCORD trials in those over 60 show that intensive blood pressure control can reduce major adverse cardiovascular events by 1 to 20%. Science Direct, however, a paper in JAMA Internal Medicine assessed how long it takes for benefits to appear. Among older adults, 60, treating 100 patients for 3 years prevented one major event, MACE. That suggests benefits appear within a few years. So, a life expectancy 3 years is considered before aggressive lowering. JAMA Network. But in frail seniors or those with multiple health issues, aggressive lowering might cause side effects, dizziness, falls, low blood flow to organs. Some older and frail patient guideline reviews advise more moderate goals in such cases. AHA Journals +1. A 2025 meta-analysis showed that even in those age 75, aiming for SBP, 130 mmHg Hg showed safety and benefit over less intensive control. Nature, so the best approach is personalized. For fit older adults with longer life expectancy, aim for lower targets, e.g. 130. For very frail seniors, more moderate targets may be safer. Always monitor for side effects. How to measure and monitor blood pressure in seniors. To manage hypertension well, accurate measurement is essential, especially in older adults with physiologic changes. Key points grounded in research. Use a validated upper arm automatic cuff rather than wrist or finger. That gives more reliable, reproducible readings. Follow standardized protocols. Rest quietly 5 minutes. Sit with back supported and feet flat, arm at heart level, no caffeine or smoking before measurement. Take 2 measurements, 1 minute apart, morning and evening, for 5 to 7 days, and share averages with your physician. Studies show home monitoring improves blood pressure control and helps to fine-tune therapy. PMC +1. In seniors, be careful of orthostatic hypotension, blood pressure that drops significantly when standing. Always check sitting and standing pressures. Some medications must be adjusted accordingly. AHA Journals Plaza 1. Also, in older adults, white coat effect, pressure elevated in clinic settings, is common. Home readings often reflect true baseline better. Accurate measurement is more than a formality. It's essential so doctors can safely adjust therapy in older patients. Research-based strategies to lower blood pressure. Here we focus on interventions proven in trials, especially in older populations. Lifestyle and non-drug measures. Diet, DASH and sodium restriction. The DASH diet, rich in fruits, vegetables, whole grains, low-fat dairy, lean proteins, is one of the most studied dietary patterns. In hypertensive individuals, it can reduce systolic BP by 6 to 11 ml/HG. In seniors, choosing softer vegetables, soups, smoothies, and low-sodium option help adherence. Sodium restriction is crucial. Many guidelines recommend 2,300 mg day, and in higher-risk cases, 1,500 mg. Trials show that sodium lowering boosts the effect of DASH. Physical activity. Exercise. Moderate aerobic activity for warga 150 minutes per week is a general recommendation. In older adults, breaking it into shorter sessions, 10-15 minutes, is fine. Some resistance training 2 to 3 times a week also helps. Exercise helps improve vascular function, reduce arterial stiffness, and lower sympathetic tone and inflammation. Weight loss, metabolic control. Even modest weight reduction, 5 to 10%, produces meaningful BP drop. Controlling blood sugar, lipids, and central obesity helps reduce vascular damage. Sleep and sleep apnea treatment. If obstructive sleep apnea is present, its treatment, e.g., CPAP, often lowers blood pressure. Good sleep hygiene, avoidance of late caffeine, and regular schedules help. Stress reduction and behavioral interventions. Practices like deep breathing, meditation, Tai Chi, or gentle yoga can modestly lower BP by reducing sympathetic overactivity. Behavioral support and counseling improve adherence. Synergistic effects. Research suggests combining diet, exercise, sodium reduction, and weight loss yields greater BP lowering than any single measure. A bundle approach is most effective. Medication and clinical management. How do we safely use drugs in seniors? Science and guideline evidence guide us. In older adults, starting low and going slow is the mantra. Begin with lower doses and titrate gradually to avoid side effects. First-line classes in older adults often include thiazide or thiazide-like diuretics, for example, low-dose chlorthalidone or indapamide. ACE inhibitors or ARBs, especially if there is diabetes or kidney disease. Calcium channel blockers, especially in isolated systolic hypertension. Importantly, some drugs may improve arterial stiffness beyond just lowering BP, such as ACE inhibitors, ARBs, and certain calcium channel blockers. AHA Journals +1 periodic drug review is vital. In frail older adults, the risk-benefit ratio may shift. Some drugs may need reduction or discontinuation. AHA Journals +1 monitor kidney function, electrolytes, and signs of side effects. Dizziness, falls, low BP upon standing. Shared decision-making. Seniors and their doctors should discuss the goals, tolerability, and trade-offs of more aggressive versus moderate targets. When lifestyle and medication are combined, many older adults can safely reach their blood pressure goals, reducing risks of heart attack, stroke, kidney disease, and cognitive decline. Sample routine. PLUS monitoring tips. Here's an example. Senior-friendly daily routine built around blood pressure control, weaving measurement, lifestyle, and safety. Morning after waking. Sit quietly 5 minutes, then measure BP before breakfast and before medication, if asked. Take medication with a small light meal. Gentle 10 to 15-minute walk. Midday DASH-style lunch. Vegetables, whole grains, lean protein. Hydrate well. light activity, stretching, chores, afternoon gentle movement, relaxation exercise or deep breathing for stress reduction, evening low-sodium dinner, avoid salty condiments, short walk after dinner. Optionally, take another BP measurement if your doctor advises. Night sleep hygiene, quiet environment, consistent bedtime. If you snore or wake gasping, inform your physician. Possible sleep apnea. Other tips. Keep a BP log. Date, time, readings, any symptoms. Share it with your doctor. After starting a new drug or increasing dose, monitor readings more frequently for a few days. When standing after sitting or lying down, rise slowly to avoid drops. Report any lightheadedness, dizziness, swelling, or unusual symptoms immediately. Use a pill box or reminders to avoid missed doses. Consistency is key. These daily habits over weeks and months gradually improve vessel health, reduce pressure, and lower risk. Myth busters and research clarifications. In science-backed care, we must dispel some common myths. Myth: because I feel fine, my BP must be okay. Reality: hypertension often causes no symptoms until damage has occurred. Only regular measurement reveals it. Myth: it's too late at my age, I can't change blood pressure now. Reality: numerous studies show even older adults benefit from lifestyle and medication changes. They reduce events, heart attack, stroke, and protect organs. PMC plus 2 OUP academic plus 2. Myth: one drug should fix it, no need for diet or exercise. Reality: drugs help, but combining with diet, activity, sodium control yields the biggest benefits. Myth: lower BP is always better, no downside. Reality: in frail seniors, very low BP may cause dizziness, falls, or poor organ perfusion. That's why individualizing goals matters. AHA Journals +1. Clarification: arterial stiffness cannot be reversed. Actually, some treatments, diet, exercise, certain medications may slow or modestly reverse stiffness, improving arterial function beyond simple BP lowering. Biomed Central +3 AHA. Journals +3 PMC +3 Scientific care is not rigid. It adapts to your health, quality of life, and individual needs. When to seek urgent help and safety warnings. While managing hypertension is usually a long-term process, seniors should be alert for warning signs that require immediate medical attention. Seek urgent help if you experience sudden, very high BP, e.g. systolic, 180 mmHg checks, with symptoms, chest pain, shortness of breath, sudden weakness or numbness in face, throat, arms, slurred speech, vision changes, severe headache, possible stroke or hypertensive emergency. Repeatedly, very high readings despite therapy changes, new onset chest pain, palpitations or signs of heart failure, leg swelling, breathlessness, new or worsening dizziness, fainting spells, confusion after starting or increasing a drug. Safety reminders for seniors. When standing from sitting, lying, rise slowly to avoid sudden BP drops. Use assistive devices, handrails, walkers to avoid falls. Ensure good lighting, clear walkways, avoid tripping hazards. Keep family or caregivers informed about your BP goals, medications, and symptoms. Regularly review medications with your physician or pharmacist to reduce interactions or overly aggressive regimens. Final message and call to action. Thank you for watching until the end. I hope that by now you understand the scientific reasons hypertension often begins in older age, from arterial stiffening to metabolic changes, and you see why managing it is critical for heart, brain, kidney, and overall health. Here's your simple research-backed start list. Begin home blood pressure monitoring using a validated cuff and record daily readings. Choose one small lifestyle change today. maybe a dash-style meal swap or a 10-minute walk. Bring your BP log and this video's insights to your doctor and discuss your treatment goals together. On Long Live Seniors, we'll continue with easy recipes, breathing techniques, safe exercises, and updates on new research. If this video helped, please like, subscribe, and share with fellow seniors or caregivers.